Another reason why I'm actually referring to research on vicarious trauma is because of the news coverage of the death of Liam Payne, the member of One Direction. There have been some complaints of the kind of coverage or images, pictures that people have seen from certain media houses that were considered to be insensitive. Media can cause some real trauma responses from folks who aren't even involved in the events. Just because they're airing it 24/7 or it's popping up in our social media algorithm doesn't mean it's a good idea for us to take it in. It's not good for us to try to metabolize that constantly. Children can be especially affected by seeing graphic footage and witnessing human suffering. Brodsky says that because kids can't fully process the difference between something that's a present danger to them versus something that's not. It's not just in the media they consume. Researchers say that kids may be vicariously traumatized from learning about the trauma of family and friends. What's more, trauma from your past can play a big role on how you respond to others' distress. If you're having a serious trauma response to something that hasn't actually happened to you, it may be because you had life experiences that need some healing. It could be an indicator that you were already grappling with your own trauma, consciously or not. And this event is reminding your brain of the distress it's already dealing with. So, what are the signs of vicarious trauma? So, what does vicarious trauma feel like? How do you know if you've crossed the threshold from being empathetic to getting sucked into the quicksand? You can have changes in mood, like feeling especially guilty, shameful, fearful, angry, hopeless, or numb. Having difficulty managing your emotions, excessive worrying, becoming detached from others or things you used to enjoy, nightmares or trouble sleeping, hypervigilance, or being on high alert. In short, vicarious trauma can hamper your own well-being and your ability to care for others. When you're living in a state of vicarious trauma, it becomes harder to maintain a level of compassion. It's harder to maintain your empathy or sympathy for other people. If you're bombarded constantly, your tendency might be to pull away emotionally because it becomes too painful. Coping with vicarious trauma. Dealing with vicarious trauma is a matter of positioning yourself as a conduit rather than a sponge. That means it's about finding ways to allow others' pain flow through you rather than soaking it in. So some of the things you can do to cope with vicarious trauma: having engaging hobbies, practicing grounding techniques like breath work, mindfulness, or guided imagery, engaging with friends and family who aren't in crisis, taking care of your physical health by eating well, exercising and sleeping enough, limiting or avoiding exposure to traumatic media, talking with a mental health provider like a therapist or psychologist. If you're a parent or guardian or have frequent interactions with kids, protect them from traumatic news programs, images, videos, and adult talk when possible. If you suspect that your vicarious trauma response is rooted in your own trauma, seek treatment. It can make a big difference. If you take care of your own adversity responses, then you'll be able to work through the external stimulation better. It won't have the same hold on you, advises Dr. Brodsky. Alrighty, my friend, thank you so much for popping by today. I hope you're having a lovely day where you are. But most importantly, I hope you're having a healthy day wherever you're watching me from. Bye.